Good day, this is Renisha from the Health Information Technology team, and today's recording we're going to go over immunizations and therapeutic injections. Starting with immunizations, there are two parts to the immunization process. The first part is documenting historic vaccine data, or vaccines that were given in the past, and ordering vaccines that are due. Documenting historic vaccines is relatively simple. The first thing you would need to do is get the vaccine records. Most of our patients have vaccine records that come from the DC Immunization Registry, which you can obtain access to by contacting your nursing leadership if you do not currently have access. Alternatively, you also are able to get vaccine information from other doctor's offices. The patient might bring it in if they're coming from another state or some other office. Now for the documentation portion, you want to access the immunizations screen from the patient hub. So you can go to patient lookup and pull up your patient. If you're in the progress note as we are currently, you can click the hub button, or you can click the immunizations button in the patient dashboard. That's going to open up your immunization histories screen, which also includes your therapeutic injection history as well. To add a historic vaccine, we're going to click Add. On the left side, you have a list of vaccines that we currently have configured for the system. The vaccines you do not want to select are the ones that have the DOH suffix attached to it. So if I wanted to order and add a Hep A, I would click the Hep A adult stock or the Hep A ped stock, depending on if it's an adult or a pediatric patient. I'm actually going to go ahead and select the D tab just for today. I'm going to click vaccination given in the past. As you can see, that's going to change several of our headings, especially the two at the top that say source of history and documenting facility. Using the drop downs, we're going to enter the information for the source of history. Where did this information come from? Assuming it's coming from the DC registry, I'm going to select other registry. Documenting facility should be wherever you are physically sitting when you enter this vaccine. So if you're assigned to a specific site, but you've been sent to another site, you must change the documenting facility to the site that you are currently at. Next, we're going to jump down to where it says given by. This is where you can type in who gave the vaccine, whatever office it was, if it was another hospital, doctor's office, anywhere else. You can free type that information in if it's known. If it's not known, this is not a mandatory field. Next down, you have your given date. We're not really all that concerned about the time, but the date we do need. So we're going to use the calendar to enter the date. You have your month drop down, and then you have your year drop down. One thing to note about the year drop down is that it only shows 10 years in the past, 10 years in the future. If you need to go further back than that, just select the uppermost or the lowermost, and then reopen the drop down. Okay? And then select your date to bring it into the record. If you need to add another vaccine, we're going to click Save and New. We're going to select another one from the left side. You'll notice that vaccination given in the past remains checked. Your source of history and documented facility remain the same. In addition, your given date and time. Had you entered a given by, that also would have remained as well, and you can make any necessary changes from there. So I'm going to go ahead and make some changes. And then I'm going to click OK. As you can see here, my historic vaccines have been documented. And it'll show in the patient's medical record moving forward. That's your historic vaccines. Next, we're going to look at ordering vaccines that are due for the patient. So what you want to do here is compare the patient's actual vaccine records to what we currently have in eClinicalWorks. So for instance, if you pulled the records from the DC registry, you want to look at what they have versus what we have. One quick tip there is that if what we have and what they have matches up, you can actually look at the report, and their report will actually tell you what the patient is due for. Alternatively, if you're in the immunizations window, you can click where it says immunization schedule, and it'll show you everything that the patient has gotten and provide recommendations. So for instance, down here where it has the MMR and varicella, it says due now. And it shows you the date that it was actually due based on the patient's date of birth. Then you have some other ones where the patient may have aged out of it. So it becomes just a recommendation more than anything. So let's go ahead and order some vaccines to be administered. We're going to click on the immunization link in the progress note. Now the difference between the immunization link in the hub, on the dashboard, and so on and so forth, versus the progress note immunizations link is that the immunization link in the progress note is linked to this progress note. It's not historic data. It's linked only to this progress note. So as you can see in the tabs here, it now says today's immunization versus immunization history, like it did in the dashboard link. Also, you'll notice that even though we saw 3 DTaps in the previous screen, it's currently saying no records found specific to this encounter. And that's because those previous DTaps were not associated to this progress note. So to add a vaccine to be administered, we're going to click Add. We're going to select our vaccine. I'm going to go with the Hep A this time. I'm going to click Save and New to add another one if I needed to. So I'm going to go ahead and go with the Hep B. Then I'm going to click OK. You would click Save and New as many times as needed to continue ordering as many vaccines as you need to. But once your vaccines are ordered, you're going to close and continue on with whatever triage or documentation that you're doing. Now, if you are ready to give these vaccines, you must make sure that the provider has checked this box here. It should say immunizations verified. So when you look at the progress note, you should see a statement in the progress note that says immunization record has been reviewed and updated. If you do not see this statement and the provider has informed you that the patient is ready for their vaccines, please make sure that they have checked the box so that this statement is recorded. This is basically the provider's approval of the orders that you have entered. Please do not take verbal orders for this. Make sure that the provider checks the box. Additionally, you want to make sure that you complete any questionnaires associated to administering the vaccines. To access your questionnaires, we're going to go to HPI. We're going to scroll down to the nursing folder over here on the left. Now you're going to find the appropriate questionnaire to complete. So in this case, we're going to go with the adult immunization questionnaire. And from here, you're basically just going to go through the questions. You can do this during your triage if you know that your patient needs vaccines, or you can do this prior to administering the vaccines. If the patient answers yes to any of these questions, please let the provider know before you administer the vaccine so that they can assess and provide documentation indicating that the patient is okay to receive the vaccines. Now, to document the vaccine is relatively easy, and this is assuming that you've already administered the vaccines. We're going to click on the hyperlink for the Hep A. It's going to open up our immunization details window. Just confirm that you have the right visit date. Confirm you have the correct dose. Note the doses are already configured for mLs, so you do not need to add anything here. We do not use dose number, so please do not change this dose number. Here where it says lot number, we're going to click the ellipsis box here. It's the little box with 3 dots in it. And that's going to take us to our lot number lookup. What you want to do is navigate to your correct facility. So make sure you have the right facility entered here. You can also come down here to the find after you've entered your facility to search for your specific lot number. You have the option to display lots for the selected vaccine only. This is useful only if the lot number inventory was entered and the vaccine was associated to that lot number. So it's going to show you all of the lot numbers available for your site unless you've used the find. I'm going to go ahead and select my Hep A. Then I'm going to click OK. And that brings various information into the documentation, including the lot number, the route, the expiration date, the manufacturer, and the VIS date. Now, the manufacturer and the VIS are fields that are required, so those two should automatically populate every time. If the route and any other field does not auto-populate, you are responsible for using the drop-downs to enter that information manually. I'm going to just complete my documentation. Down here where it says VIS given date, this is where you're just going to check and indicate that you gave the patient the vaccine information statement. If you are unsure what a vaccine information statement is, please touch bases with your nursing leadership. On this right-hand column, we're going to skip where it says status. Please do not change this manually unless otherwise notified. We're going to jump down to where it says given by, and we're going to click me. You'll note that the status automatically changes once you click me and enter a given by. The given date and time should not be changed. Manufacturer, please note you cannot free type in this field. So if it does not automatically populate, you're going to go to comments and type it here. Your VFC status stands for Vaccines for Children. And this is based on the patient's health insurance coverage. We suggest that you focus on the not VFC eligible, which includes adults and children with private insurance. VFC eligible Medicaid, Medicare, which includes only children with Medicaid and Medicare. And then lastly, VFC eligible uninsured, which includes only children who are uninsured. Unless otherwise notified, the rest of these are not applicable to this workflow. Once you've completed this, we're going to click OK to save the entered data. And you'll know it's complete because instead of it saying pending, you'll see the route, and then it'll say it was given by so-and-so on whatnot location. Now the second immunization, I'm actually going to document this one on the office visit screen so you guys can see what that'll look like via view orders. To access the office visit screen, I'm going to click the S jelly bean. And this is assuming you were already on the office visit screen and just needed to access it to document one of the items that have been ordered. So we're going to check the box and click View Orders. In previous videos, we discussed the labs, the diagnostic imaging and procedures. From here, we can also select our immunizations to be documented as well. I've already completed the Hep A, as you can see here. So now I'm going to go ahead and document my Hep B. I'm going to follow the same process that I followed before. Select my facility. I can search for my lot number based on my facility. I'm going to select it. And then I'm going to fill out all the rest of the fields as I did in the previous vaccine. Once I've completed my documentation, I'm going to click OK. And you'll see that the information will populate into the view order screen. The next thing we're going to look at is documenting therapeutic injections. I'm going to go back into my progress note. Mind you, you can document your therapeutic injection in the actual view order screen as well. It's right in the same box as your immunizations. So in the progress note, under therapeutic injections, you're going to see an order. Only the providers put in therapeutic injection order, so please definitely keep that in mind. The only time that clinical staff would put in a therapeutic injection is if the provider already ordered it as like a future order and the patient came in for a nurse visit or something like that. That's the only time that the clinical staff would actually enter order therapeutic injections. In this case, since it's a provider visit, the provider should be the one ordering this particular injection. Now this particular one is a depot, so let's go ahead and open it up. And our documentation is more or less the same. I'm going to start with our lot number. Same concept here, we're updating our facility. You can use the find to search for your lot number. And you'll notice it kind of filters out only the therapeutic injection applicable lot numbers. So I'm going to click the lot number. We're going to go with prod. I'm going to click OK. One thing to note here, if the lot number is expired, eCW is going to give you a warning saying that this has been expired and to choose a different lot number. If that happens, please notify your nurse manager ASAP so that they can update your inventory. Just like with immunizations, it's going to pull in some extra information as long as it's configured. If it doesn't, you're putting it in manually. So I've documented my lot number, my route, location where applicable, expiration date given by I'm going to click me. The given date and time automatically populates, manufacturer automatically populates. Your status will change to administered as soon as you hit me. If you need to add any comments like the manufacturer or anything else, you can add it in the comments box here. I'm going to click OK to save the data, and you'll see that it's been completed as listed in your progress note. So in this video, we have gone over our historic vaccines, current vaccines, and therapeutic injections. Thank you, and this ends this portion of the training. Have a great day.